are with the dynamic duo, the Criswell team, and we're going to tell you exactly the results of the Blue Peel as promised. Welcome, Kara and Brian. We're so excited to have you on the set tonight.
Thanks, Debra. Glad to be here as always. Hi, I'm Dr. Brian Criswell with Criswell Criswell Plastic Surgery, and I'm here today with my wife, the other doctor at Criswell Criswell, Dr. Kara Criswell, and we're here with Debra Kennedy. And as promised on the Debra Kennedy show, we're going to be performing a blue peel on Debra today for all of you to watch. One of the great things about the blue peel is it is a chemical peel that resurfaces the skin, and it gives you tighter, clearer, healthier, and younger looking skin, and it lasts for years. It's significantly less, probably half as much or a third as much as laser resurfacing, and it'll give you the same results. So what we're going to be doing today is a blue peel, and it's going to take about 10 minutes of Debra's time, and she's going to see results within a week, and then she's going to continue to see results for the next 3 to 4 weeks, and those results will last potentially for years. We're going to begin with the blue peel. It's already been prepared on the back table. This is a physician grade peel. This is not something you can have done just at any spa or esthetician's office. It's physician grade. Because of that, it needs to be done with caution and by a trained professional. You'll watch as I do it that it is very easy, and Debra is only going to feel me massaging her skin with little sponges. Robin is holding a fan, not to dry the blue peel, but just to provide a little cooling relief. In a few minutes, Debra may feel a little bit of the sting of the chemical peel. It does do what it's supposed to do. It does resurface the skin, and so there's a little bit of sting to it. But as you can tell, it's very well tolerated. This type of chemical peel gives very similar results to a laser resurfacing. We use lasers here at Criswell Criswell as well. However, lasers can run $2,000, $3,000, $4,000 for a resurfacing, and a blue peel is going to run $800 to $1,000. So it's much more affordable, and it gives very comparable results. You'll notice her Smurf-like appearance as her skin turns blue, and that's the special formula in the blue peel. And it allows me to see how deep the peel is going. It allows me to control just how strong a peel she's getting. The blue peel can be done on the face, it can be done on the neck, it can be done on the backs of hands, it can be carried down into the chest area. And all the areas it's applied to, it's going to tighten the skin, shrink the pores, get rid of age spots, sunspots, fine lines and wrinkles. Used right underneath the eyes, so underneath the eyelids and on the eyelids, so it does a little eyelid tightening. So many people who are not ready for an eyelid lift may benefit from some resurfacing of their eyelids to tighten them up.
It does somewhat like a spa treatment.
If there is any stinging involved, it lasts about 5 minutes and then slowly fades away. And we are about done. With most blue peels, you generally will not have two plastic surgeons doing the procedure at the same time. So, Debra has the opportunity today to have both Kara and myself.
I'm a lucky girl.
And that is the blue peel. We're going to let it sit here for a few minutes as it dries and it continues to work. There's still actually the blue peel, it's a TCA acid, is actually still going into her tissues and still doing its work. And as soon as that dries, it self-neutralizes and there's nothing else we need to do. And when we're all done, we'll get a little of the blue off today. And over the next couple of days, Debra will get the rest of the blue off. By about 3 to 4 weeks, you'll see the maximum benefit, and that will last years. We do recommend with the blue peel that consider having it done once or twice a year. If you have it once, the results may last 2 or 3 years. However, you can continue to get improvement if you have it done twice a year. So that's our general recommendation, is twice a year on that. The blue peel that we've just done here today is gaining popularity. It's been around a long time. I believe the reason it's gaining more popularity is multifactorial. First of all, people just are not willing to put up with a lot of downtime. They're not willing to undergo the longer surgical procedures that then they're out of work for a few weeks and can't be seen in public. With this blue peel, she's going to have a little blue for a day or two. She's going to have some peeling skin, but she can cover it with makeup in a very short period of time. So it's very low downtime. Additionally, I think there was a period of time before the economy crashed that people were looking for the next best expensive thing, and lasers gained popularity. But a laser resurfacing, which would do exactly what we did today, can run 2 to 3 times as much as a blue peel and get the exact same result with the blue peel versus laser. So I think people are being sensible about it and saying, what can I do that will give me the biggest bang for my buck, but I can still go back to work as quickly as possible. So the blue peel offers that.
Oh my gosh! Hey audience, I just wanted to let you know that this procedure was relatively painless. It was pretty much like being at a spa. Now I'm sure the blue is scaring you a little bit because it scared me, but I cannot wait for the end result, and I can't wait to show you. See you then. And now we're back. Can you believe that procedure? It was so easy. I'm going to talk to the Criswells about the after pictures and a little bit about other patient experiences. I'm going to start with you, Dr. Brian. We just showed, the great procedure. It was a quick procedure. I was amazed that it really felt like a spa treatment. With the third pass, I felt a little bit of a tingling sensation.
Right.
And is that pretty normal?
It is. I wanted to make sure that you felt like you were getting a result. So you do feel a little sting with the blue peel. But some patients hardly feel anything at all. Like yourself, you notice that there's very little discomfort, and it is very close to being at a spa.
Right. And actually, right now, we're going to show day 2 of what the procedure looked like. Day 1, I did look like a Smurfette or Avatar, some people would like to say. I could tell a huge difference. I could tell a big difference in my eyelids. Mm-hmm. They were tighter. The skin was very much tighter. Love the neck. It was, a really huge difference in the mirror and how it felt being tighter. And the fine lines around the eyes. Mm-hmm. Is that a normal reaction?
Well, I think that one of the things to consider is that you take excellent care of your skin, and you did a wonderful pre-treatment, which really prepared the skin for the peel. So in that way, you would notice that you still had the blue on, and then as the blue is coming off, that is actually that top layer of skin that's coming off. Some people may have a little bit more cracking, a little bit more of sheet kind of a peel, but those are the patients that perhaps don't take quite as good a care of the skin as you do, and probably weren't as meticulous with their post-op care as you were. So I think that your result is fantastic, and I'm glad that you didn't have some of the discomfort that can be part of the post-blue peel. But I think that it's pretty typical to have the normal tingling and have a little bit of that tightness and a little bit of peeling throughout. The blue is variable. Really, I think Brian did several layers on you to really have an excellent result, and so as a result, there's a little bit more blue pigment than just somebody who does 1 or 2 passes. So I think that you've had a really typical result for someone who takes very good care of their skin.
But the results were phenomenal. And for a minimal cost, very minimal, $800, you spend that on injections, it was such a huge difference.
Right. And I haven't seen you since the procedure, and as soon as I saw you, I could tell right away a huge difference in your neck, your skin tightness, especially around your eyes. And you and I had talked earlier that the blue peel can actually be used to tighten the skin around the eyes, and it can actually take the place of an eyelid lift for some people. And in your case, I think it's great. The skin looks tighter, the wrinkles are gone. It's dramatic.
The 2 things that are excellent about the Obagi Blue Peel is, number 1, the pigment shows you exactly where you've treated the areas, and also the depth of the blue is the depth of the peel. So you're never going to over-treat an area because you actually see exactly where you've been. When the pigment and the acid is starting to permeate the top layers, that you get kind of a look of a frosting, kind of you think of frost on the green of a grass, how that little whiteness, that same kind of frosting occurs on the face.
At this time, we're going to show an after picture. Our fabulous photographer, Angie Meredith, was so kind to come in tonight and do a picture. So, I mean, obviously I'm the walking, talking after, but she did a picture so that we could show the results of day 2, day 4, day 5, and then it's only been, you know, a little over 2 weeks. Obviously, I'm a walking testament of the results. So thank you for always taking your time to be part of our show, just sharing all the information that you have with all the years of experience that you have, and for really caring about our community and your patients as much as you truly do.
Thank you. It's our pleasure.
Okay.